Have you ever used a Dolo 650, a Panadol 500, or a Tylenol 500? Believe it or not, these are all the same medications. It's a wonder drug, but can also cause severe toxicities. Dolo 650, or just Dolo, the medication, has a generic name called Paracetamol. It is also called Acetaminophen. It is a unique drug or medication which basically has two generic names. What does this fancy term mean, generic? It just means that it is the main ingredient of that particular medication, and then the pharmaceutical companies or the manufacturing companies came up with nice, sweet, short names like Dolo, Panadol, Tylenol, so that it's easy for the consumer, for the customer to remember the name of the medication and actually buy it. As I was saying, the generic names are Acetaminophen and Paracetamol, and the sweet short brand names are Dolo, Panadol, and Tylenol. All of these are the same medicine. If you loved organic chemistry back in school and college, let's do a refresher. The official name of paracetamol is N-acetyl P-aminophenol, shortly and fondly known as APAP. So some countries called it paracetamol because the hydroxyl group and the acetamide group were para or opposite each other, and it also had the acetyl and the phenol group. So came the name paracetamol. And some countries did not want to use the prefix para, and they realized that it has the acetyl group, the amine group, and the phenol group, and so they named it acetaminophen. Throughout the video, I will refer to this medicine as paracetamol, this nice wonder drug. It has had an accidental discovery. German physicians Arnold Kahn and Paul Hepp were trying to treat intestinal parasites, basically worms. And when they administered this medication, they realized that nothing happened to the worms, but the fever went down. Accidental discovery in 1886, but took another approximately 60 years for it to be launched in the market. There were lots of ups and downs in between. And then finally in 1955, McNeil Laboratories launched Tylenol Elixir. And ever since then, we've been using it for everything. Have you ever used paracetamol or Dolo? You sure have, because everybody has. It's good for backache, it's good for muscle ache, for muscle sprain, for cramps, for a toothache. It's given after tooth extraction. It's given after surgery. It's given when you have fever. And it's an amazing drug that sort of treats lots of things with fewer side effects. What is it that this pharmacologist wants you to know about this medication, about paracetamol? I want you to know that it's quite a safe drug. It's used by almost everyone by going to their pharmacy or chemist and asking for the medication, and it's available over the counter in many countries. I want you to know that it is safe for adults and safe for babies up to a certain dose. Obviously, the dose for babies is much different than it is for adults. We dose it for babies at 10 to 20 milligrams per kilogram. And for adults, it's available in certain countries as a 325 milligram tablet, in certain countries as a 500 milligram tablet, 650 milligram tablets, and a 1 gram tablet. What else do I want you to know? There is a max dose. This is not candy, so we never want to cross the 3600 milligram dose in 24 hours. This is important because this medication can cause liver toxicities, and we never want that to happen. As I said, safe for babies, safe for adults, and safe for the elderly. In its way, it is a wonder drug because very few medications are safe for all three of those populations. How does paracetamol really work in the body? It reduces the inflammation or anything going wrong in the body, and it also reduces fever. Can I use paracetamol if I have pains but I don't have fever? You sure can. You can, but again, stick to the minimum effective dose. The lowest dose possible that takes care of your symptoms, and just stop it when you don't need it. Does Dolo 500 and Paracetamol 500 work the same way? 100%. Yes, it works the same way. They are brand and generic, which just is a fancy way of saying that they are the exact same medication. The generic medication is almost always cheaper in every country that I've been at. Choose the generic whenever you can. Is paracetamol prescribed after surgery? Many a times the answer is yes, because it takes care of inflammation and reduces pain, which is what we want for the post-surgical patients. It's usually given in higher doses like 1 gram. Is paracetamol safe for my baby? He's 6 months old, or 1 year old, or a 2-year-old. It is safe for children and given many a times when they are in trouble, they're crying, they have fever, or general aches and pains. The dose that we usually use is 10 to 20 milligrams per kilogram. So if your child is 11 kilos, then they'd be getting a dose of 110 milligrams. The pediatrician or the baby doctor is the one that should be deciding and prescribing on the dosage and the medication. So what is it that this pharmacologist really wants you to know? Well, just yesterday, I went to the pharmacy and bought a Paracetamol 500. It costs less than 15 rupees for 15 tablets. Usually people go and buy the Dolo 650. I would always tell you to buy the lowest effective dose and only buy it if you need it. This would make sense physiologically and financially. And as I said in the beginning, there are serious toxicities, so avoid the max dose. You cannot cross 3,600 milligrams in 24 hours. And of course, don't take it if you don't need it.